Your hospital has 40 to 50 return claims in 1 month. Have you ever wondered why your Philhealth claims are being audited, reviewed, or adjudicated? Most hospitals go about it the wrong way. In times like this, every peso counts. So I want to make sure that by the end of this video, you will have a profitable strategy on how to go about Philhealth claims audit. Your keywords for this video are the following. You have guarded, validate, and revalidate. Now, after almost 15 years in Philhealth claims processing, I have been helping hospitals reduce their claims return and reduce their claims denied. So, going back to my question, why is your hospital claims being reviewed or audited in the first place? So, my friends, all insurance providers, in your case, it's Philhealth, regularly conducts utilization management. So what is utilization management? It is a process wherein they evaluate the efficiency, appropriateness, and the medical necessity of treatments, services, and procedures given to the patient. Now, aside from paying the right health benefit, Philhealth is required to perform this utilization management. Basically, this is part of their task. So, utilization management has three types of reviews. You have the prospective, the concurrent, and lastly, the retrospective. So, let's talk about the prospective review. This is performed before or the onset of treatment on a case-to-case basis. This review is designed to eliminate unneeded services. Examples of these are Case Type Z benefit pre-authorization. Philhealth requires a thorough screening since Case Type Z benefit packages are very expensive. Another example is the CPSA, the cataract pre-surgery authorization. Several years ago, there was the so-called cataract scam. Philhealth required review and registration of patients prior to surgery. If the medical appropriateness is not valid, then the planned surgery will not be paid by Philhealth. Next is the concurrent review. So this type of review occurs during the course of treatment and tracks the patient's progress and resource consumption. Now, this is not so popular in the Philippines. So lastly, we have the retrospective review. So this is conducted after treatment is done. So Philhealth reviews or assesses the appropriateness and the efficiency of the treatment in order to provide data for future patients. So during the fee-for-service time, we performed medical evaluation of the claim. Then, during the all-case rate, we performed medical post-audit as well as claims profiling. Then, recently, Philhealth has implemented the medical pre-payment review. So, any discrepancies or inconsistencies will invalidate the claim, resulting to no payment. So, if Philhealth regularly performs utilization review of hospital claims, it is only prudent or it is only judicious that hospitals must make sure that each of the claim is good. So basically, do not give Philhealth the reason to deny or return the claim. So, how do you do it? Many people and even Philhealth have overcomplicated claims processing. So claims processing is nothing more than giving the right information to Philhealth. So if the information is correct, if the information is complete and consistent, then your claims will be paid. So what do I mean by this? For non-medical information, if the patient's name is Jose Bonifacio Rizal, make sure all the documents will reflect Jose Bonifacio Rizal. If you submit an MDR, a birth certificate, or in the CSF, the information must be correct, it must be complete and consistent. If the form requires signatures, make sure all the forms have the same signature. Now let's go to clinical information. Let us say your diagnosis was community-acquired pneumonia, moderate risk, or the CAP-MR. Now make sure the signs and symptoms, physical exam, clinical management must match your diagnosis as well as the case rate package. So, basically what do I mean? Clinical information must be more on pneumonia. Now, I am not saying you neglect the other signs and symptoms. Now, many hospitals, many doctors mess this up. Now, again, claims processing is nothing more than giving the right information to Philhealth. Then, you'll get paid. Now, the non-clinical as well as the clinical information on your claim must be accurate and complete. Hospitals, doctors, nurses, medical records, claims staff must adhere to this. So, make sure your staff do the following. So, step number 1. Hospitals must be guarded. Now, never take information for granted. Your patient may not tell the truth. Your doctor may fail to get the complete history and physical exam of the patient. Even Philhealth portal is not accurate. Now, ask the questions, or rather ask these questions to your staff. Is the source of information reliable? Is the information accurate and complete? Is the information consistent in all the documents? So because of this, you need to do step number 2, which is validate the information collected. So if the patient's relative says that there was no history of confinement, validate this by asking other family members. Double check if the patient has previous confinement. Review if the medical consultant's management matches, okay, the final diagnosis. Do a claims medical review. So, check out this video on claims medical review. Click the link above. Okay? Check if the operative record or the OR technique is accurate. Check if the claim form 4 information is accurate and complete. So by doing step number 2, someone should do step number 3. This is revalidate step number 2. So do a random revalidation of the supposed validated information. I stress random because if step 2 was properly done, then make a simple review. Check the completeness, check the accuracy of specific items in the documents. Friends, step number 1, step number 2, and number 3 are actually common sense. It can be done. The problem is most hospital staff are not so keen on doing it. They will say they are overworked, understaffed, or it's not their task, and many more. If your staff cannot do it, expect your claims to be returned, denied, or even go to legal. Again, PhilHealth claims is all about information. If utilization review is part of PhilHealth's daily task, then hospitals must invest in validating information before sending the claims to PhilHealth. Now, for more on the right information in claims, here is a video that may be useful. This is Coach Doc Ben. See you in the next session.